Welcome to the Between the Teeth podcast, a podcast about the fascinating world of modern dentistry. From progressive technologies to insights from experienced professionals, and from patient care to entrepreneurship, we explore the full spectrum of dental implantology for happy patients and for lifetime smiles.
My name is Marcel from Hees from Magazine Benelux. On my left side, I have Nurcan Yilmaz on behalf of Minnick Netherlands. And very welcome to Tomas Linkevičius for being with us today on this mega podcast. Thomas, welcome. Thank you.
Hi.
Yeah, thank you. Hi, everyone. So today we have you as our special guest, Professor Thomas. So you had just finished your course today with the participants for the zero bone loss concept. And here at the Megagen Center in Oosterwijk, Netherlands. So for those people who don't know you yet, I'm going to try to just briefly introduce you. You're an associate professor at the Institute of Odontology in Vilnius at the University in Lithuania. That's correct. Yes. And a visiting professor at Ghent University in Belgium. You received a dental degree from Canis Medical University in 2000 and completed your postgraduate studies in prosthodontics at Vilnius University in 2004, correct? And in 2009, he earned his PhD from Riga Stradins University in Latvia. Okay, so now you're renewed for the research on soft tissue, isn't it? And the cementation of implant restorations, correct?
Well, it's rather a little bit different information. General things are okay. I'm actually a professor, not associate, but professor in Vilnius University.
Wow.
And more I would say now I talk about immediate implants than soft tissues. But yeah, nevertheless, those were the topics I did research.
Yeah. And together with that, we also saw that you published a lot of articles. What was the most recent one you've been publishing?
So the most recent is a couple of years ago about influence of ultra-polished zirconia on soft tissues, inflammation markers in implants. So yeah.
And nowadays you're educating a lot, so you're here in Holland as well. And can you tell us a little bit about what you have done today? What was the topic about, and what was the main thing that you could bring to your participants?
The main thing was what I said in the conclusion: go immediate or go home. That's the main thing I can say to all the listeners, meaning that immediate implant placement actually should be your number one choice when you select what kind of treatment you are doing to the patients. Yeah, you need a good motivation, you need correct tools to do that, and then it really is the way better treatment than doing delayed implant placement. And today's audience was really great. I enjoyed the level. I mean, there's a high level of clinicians. You could see that they really do a lot of implants, so we have kind of got a common language. Yeah. I really enjoy that.
And if you have a look at the general view of immediate placement, implant placements, what do you think is the level overall in the world right now? Do you think it's okay, or how you can compare it to the? Yeah, okay, of course, you don't know all the implantologists in the Netherlands, but can you see that there's been tremendous change in this whole point of view?
So I think change there is, but it's always not, how to say, maybe as fast as someone would want. Many years of education against immediate done their work. So there are generations of dentists who have grown up thinking that it's like the worst thing you can do to the patient is place implant immediately. And the fruits now bear the fruits of that. It's changing. I mean, for the person, let's say, who was trained for 20 years not to do, and suddenly you cannot change like in 1 year.
For sure.
So,
Let's go one step back, because I know we've got a lot of listeners that don't exactly know what immediate placement dentistry is. Can you tell about the zero bone loss concept just briefly, and what is immediate placement? I am already doing it because I know how the technique works, but I know a lot of our listeners don't know what the zero loss.
I think that immediate implant placement, zero bone loss are different things. So immediate implant placement, I think everybody knows, you just place implant directly after tooth extraction.
Yeah.
And zero bone loss concept protocol, it's the protocol which I developed years ago, and the purpose of it is to create and maintain crestal bone stability around implants. So immediate implant placement and zero bone loss, it's two different topics, but of course they meet each other when we talk about success of implants. Immediate or delayed implant has to have bone, and that's why you use zero bone loss protocol to get that bone stability and maintain it, or even make it better with time.
Nice. I just want to go a little bit more backwards, because for the listeners, who is, okay, now it is Professor Tomas, but who are you? What family are you from? Are you married? Do you have children? Where are you raised? Where are you born? Just very shortly.
Yeah, so I was born in Lithuania. Now, I married. I have 3 children, and what was the question?
You're born and raised in. You're born and raised. You're married, and you have 3 children. And what was the year that you graduated high school and then started university? And what was the trigger for you to start doing dentistry? So do you have parents that are dentists?
Yeah, my mother is a dentist. She's retired. I guess that was the motivation, but I don't know. It was not my dream job. It was not dream profession. I mean, it somehow happened.
What did you have a dream? Did you have a dream job, or was it something else that you would have done if you weren't become a dentist?
Yeah, I planned to be a musician. So.
Oh wow! Do you still play music? Yeah,
yes,
it is.
Yeah.
It's art still.
Yeah, so I play guitar. I used to play. Now I'm not that good anymore, so kind of forgot about it. But that was, I don't know, a certain area of my life. That was a big part of my life. But eventually I'm happy that it turned out like now. But you are right. I look at dentistry, at lecturing and science from art point of view, and somehow that it probably allows me to see it more fun, not just as a boring technical profession, but there is a lot of art and science. So science must not be boring. It's depends how you make it, depends how you present it.
And I guess that's also one of the most powerful things that you are doing, because we kind of always forget how important it is to transfer information from one person to another, and especially when you have principles like yours to teach or to spread and to learn how new things are coming. So it can be very boring, but the way you are doing it, I think now, as I have a look at you, very humble, generous, but we kind of forget how much effort it takes to transfer these kind of information to people.
I have this saying, and I really think it is the task of a scientist is to turn feelings into numbers. We might feel for example, I place the implant. I feel it's deep enough. Well, but there are numbers. So when you turn everything into numbers, then we can relate it to each other. I can teach you, you can teach me. That's very important in all the professions, especially ours, that we would understand each other, put emotions aside.
Yeah.
A lot of emotions in education, I feel this, I feel that, some fights between what is better, what is not bad. So numbers are really important here.
Yeah, and if you talk about numbers, are you talking about the data that you're also put in your, for instance, kit that you have? Is it something? It's a tool you made. How did you come up with that?
I would say very, very logically, and for me it was like, this is how it should be, because when I started to work more in immediate, to placing more immediate implants, like I was not doing this in the past, I immediately understood that there are things missing, because I couldn't, let's say, there were no tools which allowed me again to be more precise in my work.
But for yourself as well, or to teach others?
Well, it's first of all for myself as well, and then of course teaching others. So that's why those really tools came. Like as an example, the first tool I designed was ZBLC insertion driver, and I mean, how can you make a driver now? Like, how can it be new? I mean, in 21st century, right? In guided implant dentistry. Well, you can, because all the drivers which are made are bone based. So you have you can place implant when you see the bone, when the flap is raised. But when you place implant in immediate implant placement, there is extraction socket. And it's difficult to see the depth with just a surgical driver.
Yeah,
that's why my ZBLC driver is soft tissues based. So when you place, you can see the depth of the implant without seeing the bone, just by referring to the driver and its position to buccal pregingival margin.
I find it was an interesting one when you said today it's not a surgical kit. It's not a surgical kit. And then I thought, that was in mind because it's not a surgical kit. You place the implant, but not surgically. So it's prosthetically driven. So that's, I think there was an interesting remark that you made to the people.
Yeah, that's another thing which I am teaching, actually talking about, that we used to see immediate implant placement from surgical point of view. Like it's surgery, make it faster. You place implant immediately. And a lot of clinicians just talk about the speed, like I make this case faster, but it's not about that. It should be prosthetic immediate. In other words, all the steps required to maintain soft tissues, because immediate implant placement is just about how good soft tissues you get after that procedure. Speed comes as well. I mean, those things are just, treatment is just done faster. But that's, of course, not the main motivation. It stands like the end of the list. Yeah. There are way more important things.
If you have to phrase the zero bone loss concept in 3 phrases, how would you subscribe it to our listeners? Because we're talking about your kit right now, and I know you wrote a book, and of course, everything must be written in your book as well. But if you have to phrase it for people to get warm, to get to know more about the zero bone loss concept, how would you rephrase it, or how would you phrase it?
I mean, I would say there is no need to rephrase, because the name stands what it's about. So if everybody wants to have no bone loss around implants, so that's really, I mean, when I was thinking of the name, of course, I didn't really anticipate it. It was like just a nice sounding zero bone loss concept. But eventually, when the course started, because in the beginning there was the course under this name, then the book, and then the kit, so it followed. Then later I realized that it's so good, because this is what we really want. To have zero bone loss around our implants, and then it really explains what you need to do.
Yeah. The weird thing is, in a market where everyone is used to crestal bone loss, that was the common thing. So it's almost a no-brainer. Of course, you want zero bone loss, but it's not so easy. But I think the nice thing is that you made something step by step, to make it predictable and to make it reachable. And what the one of the things that we heard about the kit today, and that's almost too simple. They all make sense, and it's like it's almost these tools are no-brainers in all placing or in communication. And I think that's one of the nicest compliments that people say, and that they directly understand. Oh yeah, but it wasn't there. So I think that's a nice thing.
Exactly. That's. The simplicity is the key.
Yeah.
Like
that would be a good phrase.
Yeah.
Simplicity.
Yeah. Key that when it's you understand, and again, if you explain, that's the point. Because like I do not consider, let's say, every dentist who works can place implants, because it's we all work with our hands. I don't consider implant placement as something, sometimes for me to make a filling is more difficult.
Yeah.
But those tools will just help you even more to achieve the result you want.
The thing for me is, and I'm not a clinician like you guys are, but the way I see the concept that you made or brought together, it's like it's process controlling. And if I look at a chef in a fancy restaurant or a Michelin star restaurant, he's so good or she's so good because they control every part of the process. And I think what you made reachable with the concept is that some parts we already had predictable, controlled, but some parts were very not, and now you can control them. So you want to control every part of the process. And I think that's more reachable.
As I hear right now, is like you have protocolized it, because when you protocolize it, then it must be very easy to teach. So I think that must be the best thing that you could have done.
I guess so. When it's easy, the thing is that none of us would use things we don't understand.
No.
How can you use 1-2 times and then you just, I don't understand what's happening.
Yeah.
That's always, the key, that in you understand, then you will use that.
And then the kit is, you invented the kit after you've wrote the book.
Yeah. So is there nothing about the kit in the book? There's nothing, because it didn't.
So there's a second book coming.
Yeah, precisely. No, I'm kidding.
We'll see. Because the book is about delayed implant design and how to not lose the bone around implants in delayed approach. And there is not a single sentence about immediate. But that really changed from 2019 when the book was published. I changed completely how I work.
What was the biggest paradigm shift for you to change your way of thinking to this new method you're introducing right now all over the world?
So immediate implant placement, it's not a new method. It's been forever. But for me, myself, starting from going delayed into immediate, it was, just a patient, like a couple of patients, where I tried this method and I saw the results and success. And it was enough for me to understand that really what I was doing in the past was not good. And
obviously it was good, but you needed something new or...
Yeah, and then we need to improve.
Yeah.
Can do better. But of course, I think that maybe my emphasis in immediate implant placement again was the prosthetic aspect. That it's not about just placing immediate implant. It's not about surgery. It's about prosthetic things during that placement which make soft tissue contour almost identical to soft tissue contour around natural tooth.
Mm-hmm.
I think this emphasis maybe was not really that well explained to the audience, or maybe not emphasized, because I remember always like immediate, just faster. But it is faster, but it's not about, again, the time
speed.
And if you have to mention, because everyone has inspirators. So if you have to mention 3 names, who are the ones that started being your inspiration, or where did you get your inspiration from?
That sparkled you.
I mean, yeah, you're gonna laugh, but
Can be a random person.
but
Doesn't even have to be a dentist.
Oh, thanks.
Yeah, but it's like, of course, I have people I want to thank. Surely, like I think there was my PhD supervisor from Riga University, Dr. Peter Apps. Really, he taught me a lot. However, I don't know. It's inspiration. I never had a role model.
Really?
No, I never wanted to be nobody.
It's good because then you can be unique
In
as
terms
well.
like you see the speaker, I want to be him.
Yeah.
Never.
Yeah, no.
None of this.
Who sparkled you or thought, oh, that's...
I think it sparkled like the process and results which I'm getting, and it was everything for me was very logical in terms of what I do next. Okay, this. It is not like in a traditional way, I saw some like a person, I want to be like him. I like, so no.
I'm
not
know,
that.
I think
not
now we're already talking for like approximately 20 minutes to each other, and the thing that I can feel about how you do dentistry or how you do the things that you're doing is every step you take, you think of, what am I doing and why am I doing this? Because that can be the answer of improvement. That's a little bit the way I taste the way you work.
Yeah, it's probably like that. I mean,
must be.
Yeah, it's I never really analyzed the way I work, but
you never analyzed the way you work.
In terms of like not maybe the way it was like always for me essential, or I would say that logical, that so I always thought that everybody knows about bone loss, like in terms of what to do. I was so surprised, like when the book was launched, it was like #1 for 3 years in a row, and wow. Still it is like
that one I didn't mention.
And it was, wow, okay, so people don't know that.
Yeah,
it was like a little bit strange to me.
Yeah.
Apparently, it is. So, you could say that the success key is to be clear.
Yeah,
it should be clear what you say. Like every lecture. When if the first thing what lecture must do, it provide that it would be clear what you want to say. You can have ugly pictures. You can, I don't know, don't speak well.
But the message must
be. But if people will understand, that's already good. And if, you can lose the audience like in 5 minutes or even less. So if you start to speak and, it's confusing, like very quickly, you
lost them.
You will see scrolling, like people will just drop phones, and you will be just white noise, like somebody speaking
instead of people making pictures of slides
really
like today
listening.
Yeah.
Okay, let's hack to the quickfires. Your quickfires.
We still have the quickfires. That's the problem with the podcast. We can go on, and it's. We have the quickfire is one of the topics that we have in the podcast, where we give you a few quick things, your quick answer, and we can discuss them why. And there's no good or wrong, just to experience why you. Hopefully, one of the first ones is teaching or practicing. You have to choose one. Otherwise, it's not fun as in a quickfire.
It depends on, of course, if you would ask.
You have to choose one.
Okay. Like right now, or in the...
No, just kidding. It's more like, what would you prefer?
It's like, it's very different. You would ask which child you love more.
Yeah.
I can name one. No, I'm just kidding. I'm kidding.
Okay, I will tell now teaching.
Teaching. Okay.
Yeah.
And why is that?
Because First of all, I see that the message which I am teaching is really resonating.
Yeah.
And I am doing this for already 15 years.
Yeah.
So I started educational, international about 2010. It was, I think, my first lecture in Glasgow somewhere.
Yeah.
Till that, it's still there. It's, I would say, growing, of course, compared to the past. So you must do what you are good at.
Yeah.
Yeah.
Do you have dental co-workers in your practice?
Yes, different. I mean, in the past, I had I worked in a bigger clinic, so have more people around me. Now I work in a small clinic, so I would say, I have one coworker which we really share.
It's not a coworker that you're practicing, or that you're teaching to.
No, it's like
he's already on the same level.
The colleague, which really we share the ideas, we do studies together. So it's I would say, a friend, yeah, and yeah.
Oh, that's good. Yeah. So you don't have co-workers that you teach in your own practice?
Oh, no.
Okay. That was just my question.
Yeah.
To keep that apart.
Oh, that's a good one.
And actually, I know the answer because I listened to your lecture today, but xenograft or allograft?
Oh, I would say allograft.
Yeah, that was a quick one.
Yeah.
Can you explain as well for you?
Yeah, from different points of view. If we start, let's say, the idea of using bone substitute is to create the bone, correct? And bone to implant quality is really depending on what substitute you're going to use. So xenograft, it's barely becoming bone. It's called whether you use it for the contouring, that it would be stable, but it also backfires because bone to implant contact, if you created xenograft, will be bad. I mean, this can end up in loss of the implant because of poor
I had it
bone.
A few times.
Yeah.
And I didn't know. My protocol was so perfectly fine. Everything was so good.
Yeah.
And then I called my teacher. I was like, how on earth can this happen? And he was like, okay, what kind of bone did you use? I was like, okay, this and this and that. I'm not going to mention any names. And then he said, okay, this happened to me a few years ago with the same bone structure. And I was like, why didn't you tell me? So now I changed everything to allograft too.
Yeah, because it's you cannot detect the quality of the bone.
No.
It's an X-ray, it looks perfect, it's fine.
And then you open it and then it's like you're digging in soup.
Yeah, so allograft in that sense is better. It's still bone graft.
Way better.
Because it has a possibility to be reabsorbed and changed it into the native bone. That's the first thing.
Yeah.
The other is that, of course, when you do immediate, you do bone graft also not for the bone, but also for soft tissue maintenance, because part of particles can encapsulate in soft tissues and become part of soft tissue. That's also why soft tissues are stable. And the allograft, it can be there, like I showed in the course today, the case 6 years follow-up. Remember, we remove the crown, we still see particles of allograft in soft tissue, and they stay there. I mean, there's nothing wrong, and they just contribute to the stability of soft tissues. So definitely allograft.
It was a clear one after your lecture today. Digital dentistry or traditional methods?
Digital, I would say.
Yeah.
Yes.
Everything?
Of course not. But you need to choose, right?
Okay.
you need to choose, yeah.
As I understood.
Now I'm going to be the advocate of the devil. Now I'm going to be
no middle ground.
Okay, but now I'm very, very curious. What kind of cases you won't choose for digital dentistry?
Well,
do you have?
For example, full arch.
Okay.
I still take analog impression, using my method. I created 2011, still using the same, and Of course, I scan as well but that's like for provisional and things. But yeah, this is just a simple case, not a simple, like where I would never take full digital impression. I would take.
I still do use both together
Yeah,
too. It
but me-
depends also, of course, of
Me too.
your dental technician. Because I have some technicians that are digitally very good, but you also have some technicians that prefer impressions.
The analog way.
Yeah,
we must understand it's just a way of transferring information.
Exactly.
It's not like digital is better or worse. It's more precise or less precise. Different studies can give you different results.
outcomes. Yeah,
But generally, it's just how you transform the information. And digital in this way, of course, has way more advantage than analog.
yeah, nice, good.
As long as you can see it as a tool that helps you and understand the analog way, I think.
Yes.
Yeah. Okay, good. Let's shift a little bit into gears because at times we can have like hours with you, Thomas. But if you have to give some advice to the younger colleagues, and what still drives you, and what would you give like a takeaway message to young dentists?
I don't know. It's
What drives you?
don't take any advices.
Okay, don't buy his book. Don't do his lecture. No, I'm kidding.
You can give advice based on your experience and based on your life. It's because if that's not based on that, so it's just, an expression, there's no deep meaning. I would say that, be always open to change. And, like a common thing, don't, always take everything, I would say maybe, as you said, that I didn't have those, let's say, people which I want to look upon, but that's also a strength because I never had, dogmas. Because when you admire a person, you tend to follow blindly, right? At least for a certain period of
I've experienced it.
Yeah, and then you just don't look critically at what you do.
Yeah.
And that's
You don't think for yourself.
and it really happens.
Well, you take it for granted. If someone tells you something in the first years of your when you finish university and then you go start working somewhere, and the person that you've been educated by is highly recommended, you're going to take it for granted that's the truth. And then until the moment that you get separated, and then you get new philosophies, you get new input from new teachers or new persons, and then you're going to doubt on that part. And then you're just going to think, how much percentage of that part can I take with me in order to transfer it to my patients? But that's not the alpha and it's not the omega. So you need to pick a lot of puzzles to make it your own puzzle. So if you do already have one person that you admire, you're going to be like, okay, I can't say brainwash, but actually it's going to be a little bit like kind of brainwash, because you're so into following just that method.
Yeah.
But it's not always the truth. Not in every single case.
It's always not the truth. You could say like this. And I think that, as you said, the longer are you attached to that, so, the longer then... there might be I don't know, maybe the word is not correct, the damage, but it's your closeness.
You're biased.
To that.
Yeah. So open view.
Open view.
So that would be your advice to the Thomas 25 years younger.
I would say don't have idols, right?
Don't have idols, and don't redo that last case that you showed today, probably as well, or
that's also true. So I don't know. It's those advices are always like if you are young, you don't take advices, right? You just
No, you don't.
if you are
Is that also something that you would say to yourself as your younger Thomas? If you look back, is there something that you regretted, or would you advise yourself in a certain stage of your life?
Well, of course, there are things, you regret, but eventually, if you are happy where you are now, and I am the happiest ever, because it's like, for different reasons, this is the best part of my life and career and everything. It means that everything what was in the past led to this.
Yeah.
A mistake somewhere actually is success now.
Yeah.
So
that's a good
I
one.
would say no. I mean, don't change anything. Just leave it as it is, because you don't know how you would turn if you would be different. So that's philosophically how I look at
it all
the
contributed.
things. Yeah, all good or bad, it really contributes to who you are.
Yeah.
And if you are happy, it means that all contribution is good.
Yeah.
If not, then that's different question. Okay, so then analyze. Okay, so what do you think? Because we all, let's say, the products of our failure, successes in the past, current.
Yeah.
But then you analyze. Okay, I want to change something. So that's go to psychiatry.
Well, no, it's not a bad thing to have a life coach if you're doubting about a lot of things, or if you can't handle it, because I can imagine that the stress level of what you're doing, besides not just being a practitioner, but also teaching and like flying all around the world, giving lectures and hands-on trainings, can be very stressful.
And podcasts.
So, and podcasts.
Yeah. Actually, it is, because in the past, I thought that it's really doesn't stress me.
Yeah.
But I just now understand I didn't recognize it as that it's really stressful in terms that I didn't think, I did not consider, I'd say that it can be stressful.
You enjoyed it enough?
Yeah, I mean, in certain like moments, I'm thinking like maybe I had already enough.
Yeah.
But that's that's probably natural, because indeed, I mean, the life of the lecturer and educator, it's like not an easy one.
No.
Because you need to travel. Traveling is extremely, if depending,
Exhausting.
Yeah, exhausting. And the older you get, the less you want to travel. I mean, because you've seen it all.
Children,
I mean, you have like what
family, children.
What it will bring me. So there are some things that you think, okay, maybe I will do this for the last time, or so. Sometimes,
but
and if you give over the how do you call it in Dutch? They could give over the stick. One of the topics we wanted to talk about you today as well is taking on the stage. You said the teaching. What would you say to and Megamind, for example? You did the Megamind competition. Was it last year, 2 years ago?
Last year and the year before, I guess.
Yeah, 2 times. You know the Megamind.
I've done it 2 times.
What would you advise to people, younger people now, to taking on the stage, participating in Megamind, contributing?
Just do it.
Of course. I mean, what can you advise? So it's like people, I think, do what they want.
Yeah.
And I would stand by the same message. Like, I remember one good advice, actually, I got years ago from a coach, which I took like a small course talking about like online on public speaking, how to make a lecture and things like that. I remember, like he said, you must be able to describe your lecture in 1 sentence. So what is this lecture about? If you cannot do it, audience won't understand what you want to say. Eventually, it means you are failing, because if your task is to go on the stage, you want to be invited again and so on, clarity. So that's the first thing you really must provide. I think this is like you should really be able to describe what you want to say in one sentence, and surely, of course, quality, nice pictures do not harm.
Sure.
As well, in terms of the aesthetics of the presentation.
Yeah.
I think that it always bothered me, like what I think that maybe what also achieved in the book and maybe in my lectures is that I remember going to the lectures like of dry science, when you see like a lot of letters, a lot of graphs, like, and then opposite going to only, let's say, clinical work, when only just it works in my hands, do like this without any scientific background, nothing, just combination of both is really the key of successful lecture.
So that's good advice for all the Megamind participants that are going to come. So it's a good one. Thanks.
Yeah, absolutely.
Let's head to the last two questions. I guess someone before you already.
We forgot that one in the beginning.
I want to still take a moment to ask him that question. Do you know it?
Yeah. So we have. We start with the question of our last person that sat on your chair. There was Stavros Pelikanos. A couple of time ago. And his question was, what's your idea about the one abutment?
One time abutment.
Well, to answer that question, really, years ago, we did a clinical study.
Yeah.
Like I did a study with my colleagues where we compared implants one abutment one time and implants with multiple disconnections. And I just can, describe the results and that will be, let's say, my point of view on that. One abutment one time is helpful just in the first phase of a treatment, that, if you disconnect healing abutments and impression copings, you will have bone demineralization at the delivery stage of the restoration.
Yeah.
But once you delivered final crown, you torqued it to final torque. And if implant meets all the criteria for connection stability and other things, the bone remineralizes. So we noticed, like after 1 year, there was no difference between one abutment one time and implant level restorations.
Yeah.
And what I showed today, after 8 years follow-up, if you remember, you had even better bone around implant level restorations.
Yeah.
That's
the peaks.
Yeah, that's why
nice.
As I said, I do not really consider it as a game changer. I don't know how to say. It's not. As I said, the most important factor simply does not exist. I mean, if we as humans want, that would be something the most, right? Something, I solve that and I solve everything.
Yeah.
So it's
a part, but it's not.
It's a
holy grail.
Yeah. That's really my my opinion about
nice.
One abutment one time, which is important part of all the crestal bone stability factors.
Thanks
for the answer.
Okay.
And then the next one would be for the person sitting on your chair the next time, which will be Ramon Gomez Meda. Do you have a question for Ramon that we can ask him to start the podcast next time?
Well, I would really want to ask him. Yes, I am familiar with his work. What is his opinion about restorative material? I will be more precise, like ultra-polished zirconia, influence on the results of soft tissues and crestal bone stability.
Nice.
What is this, let's say, material play a role in his protocol, in his strategy of restoring and placing implants.
I think that's a very nice start with Ramon to start
It
with.
would. So
Thanks for that.
Yeah.
I'm going to ask your last question, and that is, so last but not least, what trend or advancements do you think or do you see are going to shape the future in implantology? Have you ever thought about that, or do you think there's going to be something that will be renewed?
Well, it's always, of course, difficult to predict the future. I think it's future is near already, is here actually. Like I think that probably what we would want to have again reduction of perimplantitis. In other words, that this still main disease which compromise all the treatment, right? I mean, you can have excellent soft tissues, everything could be perfect,
And still,
you have bone loss, okay, perimplantitis, you have a threat of losing the implant, yet treatment that's unsuccessful. I think we went really very close already now. I don't know, at least in my practice, how I work, I see great reduction of perimplantitis numbers owing to, I think, zero bone loss philosophy. Yet, of course, you cannot say that it's really completely absent. So I think that if science moving towards solving, especially those cases when local factors are not enough. I mean, in general diseases like just bone starts to go away and doesn't matter what you do.
whatever you do.
Yeah. So that's still
That's also something that really intrigues me, to know what's the reason behind it.
Yeah, I would say like I mean, it's just a metaphor. Maybe I want to give you a study to support this.
Yeah,
but 95% of all cases have local thing.
It is.
And local means it's us who did it, or we didn't recognize the situation of factor and allowed it to cause perimplantitis.
Yeah.
I cannot give you like statistics, but it's like we see, and
we know it exists.
Yeah,
small amount of patients and can be perfect, and you still have bone
Still
loss.
health. Yeah.
So I think the industry moves towards that those patients could be helped.
Yeah. Thank you.
that's a good one.
Wrap up.
We're gonna wrap up. Yeah.
Thank you very much for your time.
Thank you for your.
Thank you for
I really
being
enjoyed
here.
this. Yeah.
Well,
Yeah,
it was amazing to have you here.
Thanks.
Thanks.
Yeah, like I said, thanks for your time. Thanks, Nurcan, as well, for joining at the table. So both thank you. And yeah, thanks for tuning in. And I hope you enjoyed it, and tune in next time again. Thanks.